Okay, so this is the last session of the Health Summit, and considering the fact that we've already discussed a lot on non-communicable diseases, this presentation would be about the general status of communicable and non-communicable diseases and our responses. We know that this is a huge topic, so what I'll do is that I'll introduce you all to a snapshot of the diseases that we are suffering from and what have been our responses, how successful they've been, how can we be successful. Let's go ahead. There's no apparent conflict of interest, but I have had jobs at ICMR, NIMR, and I am also associated with a lot of professional organizations. None of these have financial interests involved in this particular presentation. And there is no implication on today's presentation as well. All images, graphs, and figures are accessible under Creative Commons licensing. Some of the images are from Global Burden of Diseases, of which I am a collaborator, and they are accessible to everyone. So most epidemiological indicators in the presentation would be from the Global Burden of Diseases. We'll be covering 4 sections basically. One would be about the situation of communicable diseases to begin with, and I'll be spending more time on them rather than non-communicable because there have been sessions already. The second would be on communicable diseases, the third on non-communicable diseases, and all this will contain risk and responses as we go along. Okay, so let's start with the situation. Let's start with the situation today basically. This is what the burden of disease all over the world is currently. This is the last 2019 DALYs, which is disability adjusted life years, one of the better burdens that incorporates both mortality and morbidity. And as you can see, cardiovascular diseases, cancers, and other NCDs, which are all non-communicable diseases, they take up maximum lives. And if you add them up, the others are way behind in terms of the mortality. Then comes respiratory infection and TBs. Tuberculosis, which still takes 153 million lives. But these are aggregate data, so non-communicable diseases top. But just yesterday, about 20-30 years ago, the situation was still way different, where if you can see, this is 1990 to 2020, which is almost 30 years. And there has been a huge rise in non-communicable disease burden, as this graph shows. And make no mistake, the y-axis is about billions. So every little difference is a huge difference. It's not as if the slope is about a very thin difference. So the reductions in communicable maternal, neonatal, and nutritional diseases, which means infectious disease as well, has reduced a lot even in the last 30 years. It has been reducing for the past 50, 70 years. But for the last 30 years, it has been at a rapid pace. And the non-communicable diseases have therefore increased in terms of share hugely. What does this translate to, however, is, because that graph sometimes does not depict the true picture, is this. So since 1990s, if you talk about non-communicable diseases in males and females, it's almost similar. There is a story again that why female deaths are more, but let's not concentrate on that in this particular presentation. But if you see, globally, both sexes, the DALYs and deaths, there's a gigantic slope. You know, the slope is rising like anything for the last 30 years. So that is about non-communicable disease rise. What we take from this presentation is not only does non-communicable disease take up 67 to 70% of the lives every year, even in developing countries, but the rise in the last 30 years has been in favor of the non-communicable diseases. Let's come to communicable diseases though. The first thing that we should talk about then is, in the last 30 years, what has caused this change? And this is something that most of us know, but I'll be drawing only 3 important points. One is antibiotics. So by 1950s, antibiotics were discovered and were available in the market in the Second World War itself. This comes from the Second World War. thanks to penicillin, the soldier will come home. More people were dying because of infection and infection-related problems, and therefore, antibiotic was the biggest, one of the biggest contributors to this reduction. And when we say antibiotics, we do not mean that they save only people who are infected. Antibiotics have been hugely rewarding also because they provided us a platform for maternal infections, for cesarean sections, for surgical operations, for your simple knee replacement surgery. That wasn't possible if there were no antibiotics, because then you would have to weigh the risk and damage of doing a major operation and giving a communicable disease to this person, and you do not know how dangerous it could have been. Now, since antibiotics are there, we do not know this, but that's how antibiotics, and therefore that graph that you were seeing about reduction of maternal disorders, neonatal and other conditions, that's also related to antibiotics, because antibiotics have covered more communicable diseases and have been the enabler for reduction from other problems also. But the reduction in communicable disease especially has been due to antibiotics. 1, 2, and this everybody should guess, and it has become important to reiterate, is vaccines. If you look at the graphs, and these are 1910 graphs, if you look, for example, the middle one, polio, 1910, and mind you that between 1910 to 1940, 60s, the data reporting system were not very accurate. So it's a projection of how many cases we had. But you see, since the discovery of Jonas Salk's vaccine, and then later on Savin discovered their vaccine, it has reduced so much that now we are almost on the verge of eradication of polio. Look at smallpox, we completely eradicated it, huge number of cases, okay? And then there is measles. In measles, if you can see, which is still there, measles was very, very high. It reduced completely till 2015. Unfortunately, there have been pockets in the world where measles outbreak has happened, despite the fact that it was not reported in the last 10 to 20 years. Italy is one of those examples, and UK is the second example, but it is happening, and we'll discuss a couple of causes why that is happening. The third, and this is the most important, and we forget that the most, is social development. Now look at this graph. It is also known as Thomas Mackion's graph, one of my favorite epidemiologists of all time, public health scientists of all time. This is tuberculosis mortality. We all know tuberculosis, and this is only from 1860s. You see, if this is the reduction graph of tuberculosis, okay, deaths, and 1947 was the year streptomycin was discovered. Streptomycin is an anti-tubercular, an antibiotic that works against tuberculosis. In fact, Salman Waxman, when he discovered streptomycin, he was awarded a Nobel Prize. So we used to read in our +2 books, and I used to think, why was this gentleman awarded a Nobel Prize? Already you awarded a Nobel Prize to Alexander Fleming for discovering an antibiotic. So the principles were discovered by some scientist. You gave them a Nobel Prize. Now, are you going to give Nobel Prize to anyone who discovers any antibiotic now? But then I realized that it's not any antibiotic, because tuberculosis is the enemy of humans since centuries. And there was absolutely nothing against it until Salman Waxman discovered it. Now, take a look at when BCG vaccination came up. So that is 1 and 2 that we discovered. And BCG came up a little later than that. And we've been doing all of it. But if I were to see tuberculosis as a phenomenon, most of the reduction in tuberculosis death is neither due to antibiotics nor due to vaccines. Of course, they also have reduced further, and they were very important when the plateau phase was being reached. But the massive reduction that has been caused is due to socio-economic development. This needs to be understood very, very well, because this is happening currently in the world also. We have lesser number of cases, but those cases are there where the socio-economic conditions are poor within the countries, within cities, and across the countries as well. Okay? And we often forget that in the era of biomedical, development and more power to biodevelopment, and all my fellow doctors, they also talk about it, that, they somehow exaggerate their influence on the world. Most of the diseases are eradicated outside the hospital. You cannot eradicate or eliminate the disease inside a hospital. You can cure or treat them. In curing or treating, that has been wonderful, but tuberculosis reduction is due to socioeconomic development, and this is a pretty radical paper of the time and still considered radical by many means. So, Berlin in 19th century used to be a very beautiful city, but you'll find books where they talk about the stench of Berlin. It was so smelly because sanitation was something that was never thought of. The first sanitary awakening came after Edwin Chadwick. They studied, the poor law came up, the controversial laws. But London sanitary awakening was London became the first city that started thinking of sanitation, and they started improving their sanitation and other supplies. And this was the influence of that particular development, sanitation, water and hygiene. Anyway, because of the successes that we had during the Second World War, Sir Macfarlane Burnet, one of the Australians who is considered almost to be the pioneers of public health in Australia, he was so optimistic about it that he thought that by the end of Second World War or some years more, we will actually solve the problem of infectious diseases. They won't be a problem anymore. And boy, he was wrong. A premature victory was announced, and this victory was 70, 80 years ago. There is no victory still. What happened? What happened is that the mortality, if you're seeing from the infectious diseases, they started plateauing. There was no further reduction. And we highly doubt that there would be much reduction anymore from antimicrobial because of certain problems that we'll talk about. But if you look at it, 5 to 14 years of age, younger than 5 years age, there is some degree of plateauing in all the countries in the world. And it is not only about low socioeconomic condition. Blue is low socioeconomic condition. So in blue, you'll always see there is some kind of fall because their social development came late. But even in the highest income countries, where the high mid and high SDI are there, you find a plateau. So there's a plateauing of deaths. It's no longer getting, incidence is still plateauing, and even in deaths, there is some degree of the reduction is lower. Why is that happening now? So we had three conditions where we saw massive reduction of communicable diseases. And there are three reasons then why this is not happening anymore and why this will become a challenge in the near future. The first of which is antimicrobial resistance. Antibiotic resistance is huge. It is increasing at drastic proportion. And we believe that 10 billion people will die due to antimicrobial resistance by 2050. We are still in a situation where we do not know the actual damage. All of the estimates are, all of the estimates that we have of antimicrobial resistance are modeling based estimates, but they are too bad and we are still not investing in it. In the olden times, people thought religion was magic, but in the newer times, we think medicine is magic, and therefore, a lot of these antibiotic pressure to dispense or pressure to write up those prescriptions is a big problem. I wrote an article during COVID-19. All of the better health systems in the world had a drastic reduction in antibiotic consumption. And why is that? Because people were staying indoors. They were not getting infected. And nobody was prescribing antibiotics to them. As opposed to that, in India, during the same time, the antibiotic use increased with a drastically increased, and the kind of antibiotics that we were consuming were very high, we call it reserve antibiotics, which would never be used for common illnesses, but that was being done. In fact, a government in India was actually distributing them as prophylactic measures, one of the antimicrobials. So we did write it in scroll if you want to take a look at it. The second, in terms of vaccination, and this is very recently published by Gavi, Global Alliance for Vaccine Initiative, and they actually took my interview as well, it's a study that compares Bilaspur with Bangalore. It's pretty interesting in some ways. And this is government data based. The quotation that I said, they quoted correctly, Shweta did that, is that while 90% of Bengaluru children are fully vaccinated, only 52.5% are fully vaccinated in Bilaspur. Mind you, vaccination is free in this country. It has a very good immunization program, one of the best immunization programs that is run anywhere across the world. But even within these powerful programs, there are some differences which are huge. Now, the one problem that we have is coverage disparity. We are not reaching some people, or they are not getting immunized due to some reason. The second and third problems have cropped up recently more and more. One is hesitancy, which you saw during COVID. There is a vaccine, but why should I get vaccinated? Because I'm not sick. And the third is disinformation. Do you know the difference between disinformation and misinformation? You know?
Wrong information.
Yeah. So misinformation is wrong information. What is disinformation? Disinformation is 1 degree worse than, many degrees worse than misinformation. Misinformation is wrong information. Disinformation is deliberately created wrong information. There is some difference. However, experts argue that disinformation is created, and every human being, like a good old Samaritan, sends the forwards and spreads the misinformation. But they can't save themselves saying that, we did not know that this was created for wrong use. Every wrong use must be challenged in the same fashion. But there is a huge disinformation industry today in politics, in science, anti-science, and, or so on and so forth. This gentleman, Peter J. Hotez, his daughter had autism, and he's a doctor. And he wrote a book about it, that Rachel's autism was not caused by vaccines. And all this follows from that false hoax that was published, sadly, in Lancet many years ago. Andrew Wakefield, who said that MMR vaccine causes autism. That never happens. There is no corroborating study. The study was withdrawn later on, but it had done the damage. And now you find people like Robert De Niro sponsoring anti-vaccination, being at the forefront of anti-vaccination lobby. Now, my point here is that all the advantages that we had with vaccines, we frequently forget them, and that's why I showed that graph. So this is the second thing that is happening. The third is, and this is a major problem, frequently overlooked by all of us, is development. As you saw McKeown's graph, most of the reduction is because of social development. Not because of drugs, not because of pills, not because of vaccines. And sometimes it is commonsensical to people, and therefore we think that's not important. Now, I remember, this is 2018, I was at WHO Geneva, where mHealth was being discussed. The Indian government was sponsoring it. Digital health was something that we had, co-opted in the parliamentary meetings. And there was this document that was prepared in executive board where they said, and the document had that, in many countries, people are more likely to have access to mobile phones than they have access to clean water, bank account, or electricity, or even toilets. Now, they had written this paragraph in between, and they were trying to say, therefore, using mobile phone is a low-hanging fruit for development of health. Because their document was on mHealth. But think about it, take a step back. Think about it. When you think about it, people do not have toilets in their home, but they have mobile phones. Is it something to be happy about or something to be sad about? So therefore, we said that this is not an opportunity. It is indicative of this distorted paradigm of development, and this distorted paradigm of development is something that is sponsored by a lot of organizations here and there, where we overlook their basic needs, and people themselves overlook their basic needs and go on for forgo their basic needs to buy stuff like mobile phones. And therefore, this distorted paradigm of development is also a challenge that we are facing. So in summary, antimicrobials, vaccine, and social determinants were the reason we had massive success, but they are all threatened today because of antimicrobial resistance, vaccine coverage hesitancy, and disinformation, and maldevelopment, if I can use that word. So that finishes the communicable diseases. Let's finally get on to non-communicable diseases. And so why non-communicable diseases? We've already seen the graph beforehand, but these are the top 4 NCDs. And when we say communicable diseases, all of them are related to each other, because that there are some kind of germs that are doing all the damage. But NCDs is a gag bag, huge, big criteria where you have all of mental health, all of cardiovascular diseases, all of endocrinal disorders. So it's a huge list, but within these, the four that cause massive damage, 33 million people die each year from top four NCDs, in which almost 77% are in low and middle income countries. So we say that low and middle income countries such as India have a double burden. They still have the unfinished business of dealing with communicable diseases in places like Bilaspur. At the same time, more people are dying due to non-communicable diseases. Okay, so but the bigger problem is something else in terms of these mortalities also. But we'll come to that later on. This is India. If you see here, 130 deaths per 1 lakh population is due to ischemic heart disease, males. And again, females have a lesser tendency of dying due to heart diseases in India as all over the world, but it's slightly lesser, but it's still very high. One thing very interesting in this graph, if you see, is death due to diarrheal diseases is so huge for females that it is second highest. People don't bat an eyelid when I ask them to look hard. Why are females dying more? So much. Nobody should be dying of diarrheal diseases anyway. It should not even be fifth. Diarrheal diseases are not diseases that you die from in this century at least. This is a disease that we used to die from in the last century or last to last century. And why females are on the second has the simple reason in India, which is also the reason behind the distorted sex ratio in India, by the way. So, anyway, top 10 countries with most diabetic adults, and this is important to say, this is where we fight along, compete with China and often win. This is the only area where we win with China, although we keep on talking about it that we'll win on all the fronts. But so until recently, India was the diabetic capital of the world. It has changed a little these days, but I'm pretty sure we'll be the diabetic capital again. 134.2 million Indians have diabetes. Most of these diabetes are type 2 diabetes. As my friend says, the respected endocrinologist in Rajiv Gandhi Center, they are working on diabetes type 1. That could be even more. We would certainly top in that particular arena. Now, if you look at India's emerging threat, 7.3% of 69.2 million adults have diabetes. 10.3% have prediabetes. So that's about diabetes. Let's go ahead now. In terms of economic cost, 5 leading NCDs cost $47 trillion between 2010 to 30, which means more than $2 trillion per year. The statement is important in terms of economics is because NCDs do not only cause death. When you live with an NCD, there are two big problems in systems like ours. One, your productivity is reduced. Two, the cost of treatment is catastrophic. So there's a double damage. You live, you don't die, but you have to buy drugs which are bought at a cost at which you have to forego your routine expenditure. So that is another problem that the poorer health systems have. And therefore, this cost is important, that if the country or the health system starts proactively investing some money on this, you can save up much of this money because the loss is loss at the end. A bigger problem in non-communicable diseases is also most of the diabetics remain unknown or undiagnosed. So we do not have the exact figure. And the ones, even when they are diagnosed, most of them remain untreated. We know this in hypertension. We have our own papers in hypertension that where we call this rule of halves. More than half of the people do not know that they have hypertension. More than half of the people who know that they have hypertension do not take treatment. And more than half of the people who take treatment have uncontrolled hypertension. So in the end, the whole treatment cascade is questionable. We've done this research on NFHS 4. We've just submitted NFHS 5. It's also present in Mirzapur, Aligarh. We have all these papers that we've done ourselves. Now, what causes NCDs is something that we'll finally reflect on. And it's a huge, huge thing to learn, but I'll try my best to make sense of this graph, where you see fiber, fat, and physical activity. Along with them, there is an effect on body mass index. They are related. And then you see cholesterol, glycemia, and blood pressure. All of them cause the top 3 causes. Now, what this means then is physical activity, obesity, and food. 3 things. And these 3 things whether you keep it as intermediate risk factor or distal risk factor, they cause most of this damage. The causality chain is something like that. We frequently, doctors especially, frequently, clinicians, tend to put too much pressure on this biological risk factors. My intern says that, keeps on writing those, our interns and residents, that, you are hypertensive, you should do physical activity for so much time, and they suddenly think that that's fine. That's okay, I've done my job. And you haven't, because having low physical activity is determined by socioeconomic and environmental factors. If you live in Noida and you're advising somebody in these months to do physical activity and brisk walking for 40 minutes, the air pollution is going to kill them. Okay? So it's technically impossible for somebody to do that kind of brisk walking. Then that means that you'll advise them to do indoor workouts. For indoor workouts, you actually have to go to see those Noida homes. They're not as bad as South Korea, but it's still bad. They hardly have space for that. So globalization, urbanization, air pollution, poverty, poor education, they are gender, age, disability, unequal access. All of these are determinants of these behavioral risk factors. Who uses tobacco is determined by the society, by the education, by the age, all of this, to come from. So without working on the socioeconomic determinants, it's very difficult. And I've not even mentioned marketing there, by the way. So that is behavioral risk factors. And that leads to biological risk factors. And then finally, we have our NCDs. But that's a gag bag of all the criteria. Just towards the end, what works best? Has anybody seen, from you all, has anybody seen a good advertisement that you should eat salads? They're very useful for you. Ever. Anywhere. Are salads available in any Indian cinema hall for you to buy during intermission? Salads are only available in very fine dining restaurants at a very high price. Sometimes it is prohibitively so high that the main course is cheaper. So you're not going to buy it. As opposed to that, from morning to evening, any day of your life, how many junk food advertisements and chips and crisps are available on all the shops that we visit? How is that not going to affect us subconsciously? And this is a big problem that we have. Tobacco, junk food, alcohol. They are meaning of good life. You see our cricketers, Virat Kohli, I guarantee he probably never eats normal food that we eat. Forget about chips and popcorns and whatever advertisements that he does. And Boost, which is most recently one of the horrible things that he's doing. One of the fittest guy that we have in the country, a public figure, chooses to advertise for things that he would never eat or drink. As opposed to people like Cristiano Ronaldo, who took up Coke and, remember that scene? And some people said that this is not okay. Why is he doing it? He's not even a sponsor of Coca-Cola. They should ask my 7-year-old son the profound influence that particular instance had on my son, where he deliberately knew that Cristiano Ronaldo is not drinking it. It's a bad thing. As simple as that. So when we talk about marketing is a one-way street. All the unhealthy things are being marketed. All the healthy things are not being marketed. So it's a one-way street. And if you see this particular graph, it comes from Lancet 2010. It has worsened ever since. If you see food advertising regulation, the blue line, that is maximum value for money. So if you regulate the food advertising, it has maximum value for money. Remember our smoking packets now have disease photos on them. I remember when I was a resident, 2010, Australia and New Zealand started it. They had huge success in terms of tobacco reduction when they started with these ads, when they started showing clinical photos of patients. It had a huge impact. Of course, that impact is plateaued now, but these things do make an impact. And on the other hand, if it was not making an impact, why would there be an advertisement roping in the 3 topmost actors of Bollywood doing a Zaban Kesaria ad? If it was not lucrative, if it does not work, that means it works. These advertisements work. For whomever it works, it does work. And it is unprecedented the way it goes on. They start using the loopholes of the marketing ethical industries and everything. So there is no healthy advertisements that we have. So that is that. And therefore I'll end with Rudolf Virchow, because we frequently do not understand his quote. And that's why his quote is very, very important in the current situation in the non-communicable disease burden that we are living in, that medicine is at the end a social science, and medicine is nothing but politics on a grand scale. This is where I'll end the presentation, and if you have questions you can ask.